On this portion of the morning show from WRCO, we are saluting October, which is Breast Cancer Awareness. And in the studio with us, we have registered radiologic mammography technologist Marcia Jones and Jessica Shaw back for their yearly visit with us. Good to have you on. You know, your commercial's been playing, and they're talking about mammos and mocktails. I was wondering, Marcia, if you could tell me what that is all about.
Well, our event for October is Thursdays are for the girls at the Richland Hospital and Clinics. We're doing offering a walk-in mammograms every Thursday from 10 to 6. No appointment or pre-authorization is necessary. This screening is for women age 40 and above. If it's been 12 months since your last exam, check with your insurance to see if you're in network. New patients are welcome. Bring your insurance card, name of your primary care provider, and the facility where you had your last mammogram, if you can recall. After your appointment, celebrate your commitment to your health with a medical or a mocktail on us. If Thursdays don't work, you can always call us to schedule an appointment.
This idea for mocktails, that came to you from a patient, didn't it?
Yes, I had a patient, two patients actually came together. They were friends. They came in for their mammos, and they were going for margs afterwards. So we kind of got the idea from there, but we made it mocktails instead of margaritas.
So you guys like actually fixing drinks up there, or what are you doing? That is not usually in the job description, but you figured it out then.
No, we're just going to have some mocktails, and we're going to mix up a drink, and they'll have that. So
funny. That's awesome. That's a good way to hopefully motivate somebody, right?
Yes.
Why is screening so important, Jess?
Well, screening is the number one way to kind of know what we're getting ourselves into, okay? So as we age, our tissues change, and so having a screening mammogram gives us the ability to kind of see over time how things are changing. So we like people to start, it's typically around the age of 40. That gives them, the radiologist, a first view of kind of the way things are. If there's something in there, they will know. And then as you continue doing your screenings, it gives you a good picture of how things are changing, or if something changed that we need to further look at.
So you keep that picture from year to year to see if anything's changed. Then. Yeah,
definitely. It's very important, if possible, to have priors for them to compare them to, especially if as time goes on, if you don't have one for over 10 years and then something's there, it may look like it's something even if it isn't, but we don't know because you haven't had anything in 10 years. So it's kind of nice to have that comparison for sure.
What are some of the stats right now in terms of the likelihood that a woman will develop breast cancer?
Right now, the statistic that's out there is 1 in 8 women in their lifetime will end up with breast cancer, which really is kind of a crazy number to think about. Breast cancer is the number one cancer in women, other than skin cancer. But it's the number one out there, which is why it's so important in the month of October that we take that time to acknowledge that is something that we all need to kind of think about and worry about a little bit.
You mentioned those stats, Jessica, but I think each one of us can think of somebody who has been diagnosed with it or has gone through that journey before with breast cancer.
Definitely.
Yeah, pretty common. Is it higher than it used to be, Marcia? In terms of the likelihood, are we seeing more of it diagnosed?
Well, I think we're seeing more only for the fact that our technology has got so much better. Because back when I first started doing mammograms, we did things on, Xerox. There were 0 mammograms, and they were like blue powder on paper. And then we had, cassettes that we had cardboards that had film in them. Then we went to a machine that basically only did breast, and we had another mammogram machine, and then we improved it to digital, and now we do 3D digital. So it makes a big difference. The technology has changed, and a sensitivity of picking up those early breast cancers is huge.
The only thing that I can think about and compare it to is ultrasounds. When a woman is having a baby. I mean, it used to be they could have told me I can't see what's going on. Now everything's pretty clear. Is it kind of the same thing with mammograms?
Well, ultrasound we use as a tool for a diagnostic mammogram. If they have a lump or palpable lump, we do an ultrasound to look at that area, because sometimes we don't see that area on the mammogram, but we would detect whether it's a cyst or a cancer on ultrasound. So it's a tool to be used with, with the mammogram. But our patients under 30 years old, we would not do a mammogram. We would do an ultrasound on them. Okay. And that would, help us out. Okay,
sure. So you should have one every year after the time you turn 40 then?
Yes. American Cancer Society recommends annual screening mammograms at the age of 40. And many different agencies have their recommendations, but everybody's pretty much agreed that this 40 is the key age to start.
We talked, Jessica, about imaging and what you offer at the Richland Hospital, but does it depend on like family history and those kind of things?
So what we offer, and Marcia kind of caught a little bit of this, but yes and no. The family history can determine how early you may start a screening, or it more dictates that and how often. Again, you and your provider, there's kind of a lot that goes into it, but we offer screening mammos, which is something we're kind of pushing, especially for the month of October. We want to make sure we kind of push that along, but we also offer diagnostic imaging, which is the special imaging of particular areas. So if you have a lump or pain or discharge or they find something on a screening mammogram, we do diagnostic imaging also. And then that also leads to the ultrasound that she was talking about. So ultrasound and mammography go hand in hand when it comes to diagnostic breast imaging. So we work together to get the full picture. So we, as mammography techs, help the radiologist find the area that we're looking for, helps the ultrasound tech, and then from our pictures, it helps the ultrasound tech pinpoint the area and what they're looking for, and help determine what it's made of, if it's made of fluid, if it's solid, if it's got more of the what it's made of, or if it has like vascularity or anything like that. Mm-hmm. So, yeah.
Density, right?
Yes.
Check that out. In terms of most of the time, I would say, right, it's just a happy day and everybody goes home happy, right? I mean, more ways than one? Or
that's the way we like it. Yes.
That's the way you hope it is,
yes.
Anyway.
Yes.
Right. What are the common, like if someone says, I haven't been in for 5 years, what's the common excuse? Is there one?
Time got away from them. They forgot. Family, maybe they had a loved one or a spouse or whatever that was ill, and they were their caregiver, and they put it off, and they just put it off and didn't realize it had been 5 years and not 1 year or 2 years. But they, other important things came up, and they just didn't do it.
It used to be, I would hear that it hurts. Is it like it used to be, or is it better than it used to be, Marcia?
Well, compression is made to be tight. The tighter we get the compression, the more it spreads the tissue out, the better we can see through the tissue, and the better the image is. We don't want to, cause pain or anything, but we do want to get those pictures in. By spreading that dense breast tissue out, it does help us see, and the radiologists see those areas better, especially like in the diagnostic mammogram when they come in. Sometimes it's just superimposition of tissues, but we don't know that until we compress that area with that spot compression, and we can really get good compression of the area, and a lot of times it does save them from having anything else done.
So get that scheduled during the month of October or whenever you can. What else is happening at the Richland Hospital and clinics here in the month of October, ladies?
Well, the community pharmacy at the Richland Hospital has great giveaways every week in October. Stop in each week to register. Drawings will be held on Fridays, and winners will be notified. The flu and COVID clinic is now open by appointment only at all locations, Muscadet and Spring Green. Look for those details on our website, richlandhospital.com, or follow us on Facebook. We also have an addition of Dr. Adesana will be joining us soon. Her expertise is obstetrics and family medicine are a welcome addition. She's accepting new patients now. Oh. And right now, just want to make sure everybody knows that mammals and mocktails are, going on during the month of October. Thursdays, 10 to 6. You can just walk into the front lobby of the hospital and register, and we will take care of everything. And then you can enjoy a mocktail celebrating you.
Kitty cocktail or whatever you have.
Mocktails. I think we've got a Shirley Temple one week, and we got a different one. I've got a different recipe.
To be determined.
I've got a margarita mocktail too. So, we don't have the tequila, and it's just a mocktail, but it should be enjoyable. So.
Yeah. You guys are probably sipping them in between patients, right?
You got to try it.
So.
I mean, you're not going to know.
We don't want to give it out if it's bad,
Oh, man. Anything else that you want to add, Jessica, today?
I guess the main reason we're here today and why we come back every year is because we just want to make sure that there's awareness and a reminder for everyone to come visit us. And get those screening mammograms done so that we can, kind of keep things going and keep the community in the best health that we can.
It's like a lot of things. We talk about colonoscopies too. Something that we tend to put off from time to time, and we much rather would be proactive on things like that, right?
Yeah. Right, and it's simple. It's quick. It's not that bad. I think the majority of the people that come in that I deal with, that are worried about, is it going to hurt? Is this going to be, so terrible? Most people are like, that was not so bad, So give us a chance. Mm-hmm.
And with us being, open from 10 to 6 for walk-ins, I think that'll accommodate our ladies that, work later hours and maybe can't make it in during the week after a certain time. So hopefully they'll be able to take advantage of the times and come in and take care of them.
Walk-ins, as you mentioned then, so how often do you do those then?
Like during that time, during the day? We'll just keep going. We'll get through them as quick as we can, really. So no particular time. I would think that, those times where people are free we don't always have mammo options late afternoon, evening, actually never. So this gives us the opportunity for those that it's just hard to take off work or get out early, so this would just give an opportunity for those to come in.
So we're hoping they take that opportunity to come in and do that between those times, and it's convenient for them.
We'll hope so. Now, you mentioned starting at around 40. Is there an age at the other side? For women, in their 70s, 80s, 90s?
Well, we always say as you get older, your risk of breast cancer is more. So I always tell patients, they ask us, well, you need to ask your provider as to when they want them to stop screening. Some of them want to stop it right away. But I always say, your physical abilities to do the mammogram. And then if they were to find something, would they do something with it? And if the answer is yes, then you continue to screen. We got ladies in their 70s and 80s that do great, and your risk is more as you get older for breast cancer.
Is it like a lot of things, Jessica, in terms of diet and exercise? Can they all be factors to reduce the risk?
I don't think those things hurt. I don't know that there's anything necessarily linked particularly to that, but I think that isn't going to be a hurtful thing to try to be healthier. Plus, that leads to your ability to come do the tests. If you're healthier, it makes coming and doing particular tests, especially a mammogram, a lot easier.
Covering sports, I see a lot of sports teams, the volleyball teams do the digging for cures in the fall. A lot of them, wear pink and things like that. And I think that's important to get that awareness, especially with younger women, isn't it?
Oh, yeah, for sure. And, I think it's very easily separated into events. For the month of October, we all wear pink. and have those events. And unless there's something, very particularly focused in on that, I think sometimes it gets a little lost. So I think we do need to kind of pull that in and what does it actually mean? And so this gives us the opportunity to say, this is what this is, and this is why, as you get older and as you age, even as you're younger, you need to be aware of the things that can happen and what we can do to help with that and what that means.
Well said. How long have you been with Richland Hospital, Marcia?
I have been with Richland Hospital as of this month 40 years.
40 years. Congratulations.
Well, thank you.
That's awesome. Jessica, a little less than that.
Just a couple years.
Okay.
Just a couple years. I learn all my ins and outs from this one over here.
I bet you do.
Yeah.
Yeah. A little seasoned veteran
That's
there.
that's the word we use.
I like season.
Well, we hope people will make their appointments. If you can't be seen in October, at least make your appointment. And, that's a step in the right direction during October, isn't it?
Yes.
Yes.
Anything else either you'd like to add today?
Well, we're looking forward to seeing you on Thursday.
Good. And we'll see you next year at this time of year then.
Sounds
Yes,
good.
we'll be
about it.
back. Thank you.
All right. Jessica Shaw and Marcia Jones from the Richland Hospital talking about Breast Cancer Awareness Month during this month of October.